Hello and welcome to the Physical Therapy Clinic in Tullahan in County Leitrim in Ireland. My name is Gareth Phelan and I like to take the biopsychosocial approach to prehab, rehab, exercise and treatment. Today we're going to have a look at a case study of a young male, 33-year-old Stephen McGurran, who is a very talented musician, previously high-functioning GAA Gaelic football player and is now a sports coach. Stephen had to retire early from his sport due to hip impingement and a subsequent major surgery on the hip. So we're going to take a look at Stephen's journey right the way through all his stages of rehab, from post-operative back to getting him to a stage of fitness and exercise that he wants to be at again. Now, the journey is still ongoing, but we're going to take a look at a lot of it so far.
Thanks very much, Stephen, for coming in and helping out with this production here that we're going to do. I think it's going to be really useful for anybody who is going through any type of hip surgery, any type of surgery that involves a full hip replacement or hip resurfacing. People can see a rehabilitation program when you start from a very low base and start having to work through.
Cheers for having me, Philo.
You had congenital hip impingement, isn't that what it was called?
Yeah, that was it, on the ball.
On the ball of the femur. So they talk about cam and shaft hip impingement, and that's where there's an extra little bit of bony growth either on the ball of the femur or the socket of the pelvis. So you had it on the ball of the femur, and that meant that when you would try and get to some of your outer ranges of movement with the hip joint, that you'd feel restriction and pain. Is that right?
Yeah, sharp pain at the end, or would say just before surgery there. And for the last few years, yeah, really sharp pain. Depending on how active I was that day, but it was constant dull pain then for the rest of the time. But when I was very active, it was a sharp pain.
Okay, and what that done, I suppose, just to give people a bit of a background, that impingement over a long period of time, it begins to break down the natural shock absorber, the cartilage in the joint, so you get this deterioration in the joint. And then any type of impact work on that joint, it doesn't feel too good on it then after that. That's kind of the way it was. Huh?
Exactly, yeah, bang on.
Right, so you got to a stage then, did you tell me it was 2013 where you went and you got some keyhole surgery done?
Yeah, I got it tidied up a little bit that time.
And Stephen, that was kind of debatable as to whether that was of any benefit or not, is that right?
Yeah, I suppose looking back now, it didn't gain me a lot really, but on the other hand, I suppose I'd done it to try and play a little bit more football. Fortunately, when I came back from that surgery, I'd done my ACL in my left knee, so that hadn't happened, I might have got 2-3 years maybe out of it. So it's hard to say now. Look, it didn't really gain me a lot looking back, but like if I didn't do my ACL, probably would have played a bit more.
Yeah, so you had poor luck really. You had just gotten back from keyhole surgery on that right hip, and you had rehabbed back. You had got back to playing football again, and then you ruptured your anterior cruciate ligament on your left knee. And from anyone's currency, that's just poor luck, isn't it? So you went through a full rehab program on the ACL, and then you got back playing again.
Yeah, tried to play a little bit more. My knee, I was delighted. My knee was fine. It was strong. But my hip again started to flare up fairly soon. So I suppose one last effort to see what could I do. I went up to Éanna Falvey actually in Santry to see what his thoughts were.
Éanna is a hip and pelvis specialist, and he would have been working out of Santry up there in Dublin.
Yeah.
And what was his best advice to you at that stage?
Before we even done a scan, he says, look, we know you're going to have a bad hip here. Anything's a bonus at this stage, really. And that's what I wanted to hear. I was delighted. So we got the steroid injection in to see how would that do, and at least get me back level, get me gym work going again, try and make it as strong as I could in there. It got me a few months, yeah, I'd say 3-4 months maybe. Then it just got bad again then pretty much.
So his best advice to you at that stage was just to do a lot of strength and conditioning work all around the hip and try and avoid any unnecessary loading, impact work on the hip.
Avoid any of the heavy running, anything like that.
Yeah.
But even by the time I went back to him, Christmas 16 maybe, I went to him, so that's 3 years. The bone had actually grown back. That was taken off the keyhole. It was back already, like.
So you chose to have a hip resurfacing as opposed to what most people would be familiar with is a total hip replacement. So give us, if you would, a wee bit of insight into how you made that decision.
Yeah, so just when I started researching into both, I seen the first alarm, I suppose, would have been, I'm 33 now, if I was to get a full hip replacement, given how active I am at work and how active I plan to be, I suppose, going forward. I definitely would have went through 2, if not 3 hip replacements, I was told, from the wee bit of research and digging I had been doing. So
like a car going through tyres.
yeah, so that was a bit of a worry. At that stage I probably would have lived with it. I would have been happy to be pain free, to be honest, but the idea of not being fit to run or be really active like I wanted to be, that was a bit of a worry. So started looking around and seeing this about the Birmingham hip and started researching into the surgeons over in England and just into the whole surgery and kind of looked at success rates coming from it and stuff like that. And I seen the surgeon I went with had a 98% success rate after 20 years.
Which is good. And to give people just a wee bit of an info on the resurfacing, so it's the surface of the ball of the femur and the surface of the socket of the pelvis are replaced, as opposed to the full ball and neck almost of the femur is normally replaced, and the full socket is replaced with total hip. And so there's a lot more taken out.
Yeah.
And there's a lot more components put in there. So that's what was done, and you've been given better prognosis in terms of the amount of stuff that you can do with this physically and the amount of time that it'll probably last as well.
Yeah, totally. The sky's the limit was my surgeon's words, when I was finished there. So
that's what you want to hear, isn't it?
Yeah, brilliant.
So listen, in the end, I guess it wasn't really a difficult decision for you, was it?
No, not at all. I had my research done. The surgeon was Ronan Tracy that I went with, and he's the best you can get, so I was very, very confident and very excited, I suppose, about getting it done and having a more positive outlook on life, nearly in general, and everything, just a bit of a buzz and excited, looking forward to being active. And,
yes, yeah, that kind of leads me in. That I get you to give us a wee bit of insight into just your response, your psychological and your emotional response to getting the surgery and having to start at such a low level of ability again, just to begin the process of rehab, because you're somebody that would have played club football, inter-county football, Gaelic football that is, so that's up to an elite level, and that's as good as it gets really in this country. So going from that level of physical ability all the way back down to base again, give us a wee bit of an insight into what was the impact of that on you. It's 13 weeks ago now since you got that done.
Yeah, really positive, I have to say. I just had such a poor quality of life. I wasn't fit to run, like I say, or do any. Everything was just a struggle to get by, even working in the schools or out in the pitches and clubs or whatever. So really positive, really excited since I got it. Pain free already, realistically. I'm used to rehabbing at this stage. It doesn't worry me in the least. It's just like, instead of going training, I suppose you're going to the gym to do my rehab anymore like you used to, but it doesn't worry me. I can't wait actually to keep at it and back to full strength again.
So it didn't really knock you for 6 at any stage? You didn't have any massive struggle? Is that what you're kind of telling us?
Definitely not. No, once I decided I'm going for it, I couldn't wait to get it done, and it's been just positive since, really. Delighted with it. Tiny little things, maybe I thought I might have been off the crutches after 6 weeks. I was on them for 7 or 8. Wee things like that, you're always kind of thinking, the pain was a different pain straight away. Yeah. It was just that dull, dead pain in your hip was gone. My lower back I found totally freed up already too. It seemed to be very tight all the time. And
so you would have even been having sort of tension and discomfort even with normal day activities, even kind of sitting around.
Constant, that dull pain in there. And then my lower back I found was always really tight.
And as of today, which is about 13 weeks post-surgery, what's your level of discomfort or tension like in around there now?
It's a little bit stiff after doing my gym work, or say walking a lot now, cycling a lot. The way I'd put it would remind you of maybe after a match, your muscles, that pain, that tightness, stiffness, but
like you've worked something.
Exactly, yeah.
Okay.
But nothing like the dead pain. And again, the lower back I found was always just really hard to sleep. Was tight. You were walking around uptight, stiff.
Yeah.
So we're driving, just all gone already.
Well, that's a bit of a result even so far, isn't it?
Yeah.
And we're at week 13 now, so I guess mentally you're feeling pretty positive about this. And physically, how are you feeling now? Just looking back at some of the footage there of what you've taken, and for the first couple of weeks, I suppose you looked like a newborn lamb, but it looks like the strength is coming back into your body here again now. And how are you feeling physically with it?
Feeling good. It's a slow enough process, I suppose. But now it's starting to feel real solid in around it. Feels safe doing some of the exercise. I mean, it surprised you a little bit sometimes. You think, the last time we had the star plank with the 3. I was like, not a hope is this going to happen, and next thing, just
And
no
then,
problem.
then it clicks in.
It's amazing, yeah.
Yeah, and tell me, well, just going back to some of the exercises there for a moment. Yeah, certainly one of the days that you were here, about 4 weeks ago, 3 or 4 weeks ago, and we tried 1 or 2 things with mobility, and it just wasn't happening at that stage. But then when I seen you here again, that was 3 or 4 weeks after that, and it seemed as if just those couple of movements that we had been trying have just unlocked.
Yeah, the pelvis.
The pelvic tilt,
Yeah.
Your mobility with your anterior pelvic tilt. That seemed to unlock really well, and that seemed to unlock some rotation in the hips as well.
Yeah, I always had pretty good flexibility going straight on, forward and back, say, but anything going sideways, it turned my stomach, like, to be honest. It was just like, oh, no way. But now, already, the new program has started, I've got loads of the hip rotations, all them, no problem at all.
Fantastic, isn't it, the way that movement is coming back for you? And just finally, Steve, where do you see yourself in terms of your own functional ability now with your goals going forward, getting to the end phases of rehab? We're at week 13 at the moment, and I suppose realistically you would be looking at getting through to about the 6-month mark, and anything after the 6-month mark, we're looking at getting into the final stages of your rehab there. So where do you see yourself? Where would you like to be with that, and what level of functionality would you like to be getting to?
Yeah, I suppose I hope to get back to where I would have been around 2011, 2012, strength-wise, fitness-wise, probably the best shape I would have been in. I'll definitely get back to that anyway. Probably going to avoid contact sport here on in, I'm afraid, but looking at triathlons maybe, some cycling, swimming, running, stuff like that. That's the plan.
I suppose it would be just nice to be able to run again, wouldn't it?
Yeah.
Without pain-free.
Yeah, Paddy's Day is roughly the time I'm allowed to run again, apparently, so I just can't wait, yeah.
That's a nice goal to set for yourself. St. Paddy's Day, you're going to be running out over the side of a mountain somewhere for the first time in a couple of years.
Can't wait, yeah, definitely.
Well, hopefully this materialises for you, and we'll do all in our power to make it happen. Listen, thanks a million, Steve-O, for coming in and helping us out with this, and I hope this is useful to anybody who's of the mind to watch it.
Cheers, Philo. Thanks for having me.
We've just been talking to Stephen and reviewing the hip pathology and the subsequent surgery, along with why Stephen chose the resurfacing option and why he travelled over to the UK to Birmingham to meet with Dr. Tracy and have this particular procedure done. We've also looked at Stephen's journey through the phases of rehabilitation, from his crutch walking, from 2 down to 1, down to free walking, and from his open chain exercises in the earlier sections of the video where he was non-load bearing, to his closed chain exercises where he was fully load bearing body weight and moving in lots of different directions. We looked at the different progressions from his increasing range of movements and strength, along with balance and control all around the hip joint, and how that connects to full body movements and function. When Stephen reached his goals in the phases mentioned, the next progression was to have him begin to hop and land in different directions, starting with both legs and progressing to one leg. These are called plyometric exercises and are used in rehabilitation to regain neural control and power for acceleration and deceleration, all of which are needed for a return to jogging, running and sprinting. The final part of the video shows Stephen reaching his goal of getting back running again. He reports having no pain in his hip joint, and he feels very confident to push hard into the higher intensity sprinting. This outcome is a testament to the good work of Dr. Tracy and to the focus and adherence shown by Stephen to consistently work hard throughout his entire rehab journey. Many thanks to Stephen for taking part in this, and a special word of thanks to Marion McFadden for her hard work and patience in putting this production together.
gotta take a chance and forget all romance. Just take a jump into the palm of someone else's hands. And when you find your way, you'll always wanna stay. But you've been ripped apart, just can't find the words to say.
You said temptation takes control, but I know the secrets that you hold. You've been living for the night, you should be living for your life. Gotta take it for one ride, you better pull it out tonight. Oh, tonight.
I built a new machine to wipe the slates clean. But bad decisions that were made will never speak again. You stare up at the night through someone else's eyes, but now your future's bright.